Are we ready to go?
It takes just a moment for the live stream to load, so if you don't mind waiting about 10 more seconds. And all right.
All right. Welcome to this month's Ward 5 Public Safety Call. I'm Councilmember Zachary Parker, and I'm thrilled to welcome you to this conversation about all things public safety. We're thrilled to be joined this month by our MPD partners, in particular 5D, the 5D team, as well as Fire and EMS, and our friends at the Department of Behavioral Health. The goal of these conversations are the same month to month. It provides a opportunity for us to update you on what's happening across the city to keep neighbors safe and provide a platform for you to ask questions directly of our public safety leaders. And so with that, we're going to jump right into the contents of our call this month. Here's a quick outline of our conversation. We'll be joined by Commander Rooney and Captain Augustine from MPD. We will have updates from Fire and EMS by none other than the extraordinary Alexis Squire. And then Anthony Hall will share updates from the Department of Behavioral Health. I'll provide some very brief closing remarks. But we also hope neighbors are staying warm and safe given the inclement weather. Headline in terms of Ward 5 is that crime is down across every major category. Just about. We're seeing more than 50% reduction in both violent crime and property crime in Ward 5, and these trends are mirrored across the city. This builds on noticeable trends in recent years, where in 2024 we saw a reduction of about 30% of violent crime, and in 2025 there was a reduction on top of that of an additional 29%. We want to just zoom out a little bit. Despite the rhetoric to the contrary, we have been seeing violent crime trend in the right direction for several years now, even prior to federal involvement in the district. But even still, we are not satisfied and know there's more work for us to do because one violent incident, one homicide, one car robbery, you name it, is one too many. We also know that given the time of the year, there are an uptick in fire incidents, which is why we wanted to have our partners at Fire and EMS on today's call. Current concerns that we are keeping track is that there are ongoing issues from the snow incident or the snow storm that we had a couple of days ago. I am in touch with the DPW director. I am aware that some neighbors are flagging that the tracking system from DPW may not reflect full accuracy about which streets have been treated versus those that have not. We are urging DPW to circle back to certain communities that have not received full treatment, and we hope to have an update with you soon. Yesterday and today, schools, or at least DC public schools, were closed, and I believe all charters as well. And we are awaiting an update on tomorrow's posture. I would remind neighbors that it is your responsibility to shovel the immediate area in front of your home, as we are also receiving reports of neighbors having a difficult time traversing sidewalks. We do plan to have a discussion about the homicide in the 1300 block of Varnum Street Northeast that happened last week. We know that this is technically in 4D. But we are going to ask our 5D partners to at least speak to that. That was of note in part because that area of our ward is fairly quiet and we're not used to seeing violent activity, but it was also the first homicide of the year. And so we want to just provide an update of what we know, what MPD is doing to track down that case. As we continue to drive down rates of violence across the district. And then last but not least, LIHEAP, ERAP, and other assistant programs are extremely limited. My team will have updates and will use the chat for links that you should be aware of. And with that, I'm going to turn it over to our 5D partners. I believe we have Commander Rooney on. And so, Commander, I'm going to turn it over to you. And it's good to see you.
Good to see you too, Councilmember. And thank you so much for having me. Really appreciate it. I do want to get right into the meat since you had brought up the homicide. I wanted to bring that up first. What we do know is that this happened in the 1300 block of Varnum Street Northeast. I know that this is a quiet neighborhood. I do want to let you know that it was an inside scene with known persons who were inside. A dispute took place inside, which resulted in some violence. That violence escalated into a shooting, and unfortunately, our victims succumbed to their injuries. Although we have some persons of interest and we've interviewed everybody that was on scene, it still remains open. I don't want to say that it's going to be closed anytime soon. Some of these cases take a little bit longer and a little bit more massaging than others. Sometimes we're waiting on DNA to get back, and other things to happen in that case. So we will keep you posted on once a closure is made in it. However, at this time there is no other. This didn't happen outside and somebody shot up the house or anything like that. So I want to make sure that it is known. Next, I wanted to bring up the barricade that happened at the 150 Q Street Northeast. This happened about a week and a half ago, and we got a call for two individuals who were assaulted inside of their home. Another known suspect. The person went inside. They were either buying narcotics or tobacco products. That guy got angry and started attacking the two that complained about the cost of the actual either narcotic or the cigarettes or whatever they were buying at that time. It resulted in some violence. The person that assaulted them went back to their apartment, said, "I'm getting my gun." So we arrived on the scene, and the person that was inside of his apartment, he we heard a loud pop in there. We thought it was a gunshot. We were talking to him through the door. It ended up being fireworks. Anyway, he threw another firework outside of the door, and it resulted in us declaring a barricade inside. We didn't know what kind of person we're dealing with here, so we tried to wait him out. Finally, we were able to execute an emergency search warrant, which was authored by us, and it was actually signed off on by the DC Superior Court judge. Once we entered, we were able to arrest our suspect inside. Once inside, there was a handgun that we recovered, along with fireworks and some firework making explosive device that you can buy at most any sporting goods stores. I can't remember the name of it. I think it's don't hold me to this, but I think it's Tamarack. It's inert when by itself, but however, if you mix it with something, it becomes extremely explosive. So that is very concerning. We went ahead and arrested him. He was actually being papered in Superior Court. However, there are federal charges that we actually added onto that. So that was in the grand jury last time I checked. So that case is closed with an arrest. Major challenges, as you see up there, one of our major challenges were juvenile crimes, robberies, and serious assaults. And I wanted to tell everyone on this call, it has been a blessing to work for 5D. The community here has given us so much information. We cannot do this alone. As you see on the bottom right-hand side, our robberies, although it's a major challenge, and it still is here in 5D, we reduced the amount of robberies by 25%. That's not an easy task. A lot of our robberies were kids that were on the lime green bikes, on the mountain bike trail, in and around the area. And some of them didn't get put down as robberies. So for instance, some of them were thefts. However, what they would do is they would come up behind them. And I know I talked about this on one of the last calls. They would go behind people that were wearing the AirPod Maxes or the headphones while on the mountain bike trail or in and around Noma, Eckington area, especially Union Market and the like. But what they would do is they grab them and they would run down the street, and you see an adult person chasing after 14 or 15-year-old kids. They make their escape good. And we closed a bunch of those robberies. However, we need your help. If you see some of the kids, especially if it's school time is when, the kids are supposed to be in school. Of course, they're off with the all the snow that we've had. But the only way we get some of those crimes out of there is by place them under arrest, and it's usually the same pockets of kids that were happening, and sometimes they were doing that out of fun at some point, and they don't realize it goes down as a violent crime. So we made a bunch of arrests off the mountain bike trail and in Eckington and the surrounding neighborhoods there. The other thing is the motor vehicle thefts. Actually, before I jump over, I wanted to make a quick comment regarding the juvenile crimes. One of the things that we've done that we've upped this year, as opposed to last year, is our truancy, our response with truants. Last year we'd have like a handful of truants that we would bring back to school. This year, at times, we were averaging like 12 or 13 truants at a time in Union Market, around the Noma area, and some of the metro, lingering with their friends and things like that. One week, I think we had like 60 truants on 1 week. So that has tapered down since we've had our truancy gone up. And guess what? Our robbery trends have gone down, minus 25%. I wanted to bring this up too while I'm on robberies, because I'm super proud of this. Robberies for the year right now, we had a great year last year. Like I said, minus 25%. No robbery is not good in my book. However, we are down minus 63% from January 1st to January 26th this year. So we're trending in the right direction. To be down minus 25% the whole year last year, and then minus 63% this year is really a good feat in itself. So we're going to continue to keep the pedal down on the violent crime. And then the motor vehicle thefts, motor vehicle related crimes in general, last year, a total of minus 32% motor vehicle thefts. A lot of that is attributed to people leaving their cars running. So please, I cannot stress this enough on this call, to please, once you get out of your car, don't leave it started. I know it's cold out there. If you're going to be in there, just start it up. If you have the remote start, great, but don't leave it running with the keys in the ignition. Some of the kids would just take it and they joyride, or they'll leave it for somebody else. And the thing is almost 50% of our crimes that were involving motor vehicle thefts were Uber Eats guys, or someone just leaving their keys in the car. It wasn't someone coming up and hot wiring it or jamming a screwdriver. 50% of them. So I've gotten our traffic officers to start writing tickets in areas that are where Uber Eats drivers frequent, and they leave their cars running. And it has really brought down our motor vehicle thefts to have. This year alone, we have only had 14 motor vehicle thefts. 14. Last year, this time, from January 1 to January 26, this is real data, 88 of them were stolen. 88 in January 1 to January 26, 2025. This year, 14. That's literally such a huge difference. So the guys are out there pushing cars along, making sure that we're being a little bit more visible in those areas. And we've increased a lot of our foot traffic and our foot patrols and our mountain bikes. Some of them, my mountain bike guys are a little bit upset with me. I had them out there in the freezing cold, and then but we need them out there on the mountain bike trail and being highly visible. So if you see them, say hi to them. I tell them to go into all these restaurants, all these different businesses to get to know people. So those are some of the issues and some of the good things that we're doing. Other things, of course, are violent crime, are violent neighbors, or violent neighborhoods where they have TIFs. The Pinnacles and Benning Courts, we had an issue last year with those. We have increased our presence there and in Trinidad with ongoing high visibility officers. We've got about a dozen per shift that just are high visibility, going in, meeting with different managers of businesses, different property managers and things like that. And it's really worked out to an unbelievable amount. Since last year, we haven't really had any of the same shootings that we had like we did, from January 1 to like June, the end of June. So even in July and August, when things are a little bit more heated and people are out and about, we didn't have the same issues. So that's a good thing. I did want to bring up a couple other things that we've seen, that we've gotten more high visibility and some more officers out on the street. We have seen an increase in domestic violence. Inside scenes have gone up, along with our burglaries, some residential burglaries. We've had a couple ticks of burglaries, even though we're down right now by about 20%. I still want to stress, when you're walking by somewhere and you see something that doesn't look right, please call our anonymous tip line or call 911 immediately. Because if we get there and we can prevent that crime from happening, I'm all about it. Some of these businesses, the business up on Benning Road, I think it's 2301 Benning Road, the Hip Hop Chicken, got hit 3 times before we were able to put together a good operation and arrest a suspect. We ended up closing that case out, but 3 times. And when I talked to the business owner, although on paper we look at like, oh, there's 3 stats of a burglary. No, there's the owner there. He says he doesn't make too much money during the wintertime. He relies on different things, and he doesn't want to go through insurance because it breaks the window, and then all of a sudden his insurance goes up. It's not about the guy breaking anything or really taking anything, because he didn't get anything. However, the window is broken. So, it's just one of those things. If you see something, please say something. I do have my anonymous tip line up there and Crime Solvers tip. And Oliver, if you could put that in the chat, that would be huge for me. Really, really would appreciate if you put the Crime Solvers tip line and then an anonymous tip line there. And then, of course, our text tip line is 50411. That is give 50 the 411. So a couple new initiatives. And before I let Councilmember take it back over, the first one is our high school mentorship program. This goes hand in hand with our truancy. This is something that we're doing. We launched this it's a targeted mentorship partnership with a few different high schools, to include Monument Academy, Friendship Public High School, where we're providing guidance and leadership and some development, and trying to be a positive influence on some of the younger generations, trying to build a long-term relationship. And we're not just going there like 1 time or 2 times. We're going there weekly. To these, we'll have a few different officers assigned to different places or different schools, and they go in and they meet with the students, they talk with them, they build relationships. And then that brings me to our summer outreach expansion, something that we're doing a little bit different, and something you'll hear me talk about over the next couple of quarters too, is we're partnering again with the Departments of Park and Recreation centers to extend our youth engagement programming throughout the summer months. Some of the things that we're doing, camping, along with assisting with homework or summer school, and also doing like fishing trips and things like that, to really try and give some of the younger generations, a different perspective of the police. So other thing, last, before I bring up some of the other positive impacts that we've had, are like I said, our mountain bikes and our footbeat patrol, but in and around the metro, and I know everybody has seen the National Guard. So that has increased our presence, especially at Noma, Brookland, of course, Rhode Island Avenue, really helped us out a lot with visibility. They're not necessarily in the neighborhoods or anything like that, but we have been noticing a decrease in some of our crimes in and around the metro areas. So that's a good thing. And then our traffic vehicle initiative, I know you heard me talk about it with regards to motor vehicle related crimes. And it's not all about ticketing people. It's also just keep people moving. Sometimes individuals will sit in one place for a long period of time, and then they'll get out of their car and someone will hop in it and take off on it. So we're trying to prevent those things from happening. So before I open it up for questionings, wanted to bring up a couple different things, couple applause to the officers, good members here. Our motor vehicle thefts are down last year, minus 32%. I got to bring it up one more time, minus 84% year to date. I'm not getting excited. We're going to keep our foot down on the pedal there. Motor vehicle related crimes, meaning theft from autos, breaking a window, taking things out of it, minus 22%. Overall violent crime, minus 21%, which is almost over 100 people did not experience some sort of violent crime than they did the previous year. And I'm going to keep pushing that, because one violent crime is too many. And then overall crime, minus 19%. That includes our property crime. Burglaries, at one point last year, we're at plus 71%. Last year, we ended burglaries at minus 29%. And this wasn't a new initiative, so I didn't really put this up on the PowerPoint, but we have really focused that around from like 10 p.m. to about 6 a.m. We have kind of not staked them out, but like we'll do some true business checks. We'll go up to the business. We'll pull on the handle. We'll look inside. We'll go to the back of it. We'll be in the area for longer than we need to. If we see something just out of the ordinary, we're stopping individuals to make sure that they're where they're supposed to be and kind of checking them, but not without cause. But overall, it was a really good 2025. I look forward to this 2026 being super impactful, and I cannot do this alone. And I really appreciate the support from the council member, Oliver, all of you at your office has been tremendous support to me in my first year. I can't thank you all enough. And if anybody else has any kind of and anything that we could do at 5D to better our relationship and to make the community safer, I am all ears. I'm all about trying to reduce it. One of those stats are up there, it's too many to me. So I really take it personal when something happens in 5D. And council member, and I know you, Oliver, as well, we all take it personal when something happens here in Ward 5. Please let me know if there's anything that you need or anything I can do to better myself too. So anyway, that's all I'm gonna say. I'm sorry I'm a little long-winded, everybody. I apologize, but I appreciate you guys giving me the opportunity to at least talk and anything that I'm willing to take some questions or answer any questions you guys might have.
No, we're happy to hear good news. And so please take as much time as you need to share the progress that we're making as a city and in Ward 5. Oliver is going to lead us through our question portion. We have some pre-planned questions, but we also want to open it up to the public. I'm going to take a personal privilege and ask a few questions that I have in rapid order, hopefully. You spoke about the coordination with the National Guard. Where is that data recorded? If they were to apprehend someone or interfere in an incident, is that recorded as part of MPD's data or is that shared somewhere else?
Yeah,
Or is
so
that recorded at all?
I think one of the biggest misnomer, and I know there's a lot of politics behind this, council member, is like they're there for visibility. I rarely see them personally. I see them like today. Of course, they're here because just in case they were given rides in their Humvees with snow. If essential personnel couldn't get out, they were given rides to and from. However, they are providing support to us. They're not making arrests or anything like that. They're not stopping individuals. They will say something if they see something, but other than that, they're not authorized to make arrests. And if there is an incident, it happens in-house with them. If there is anything else, for instance, if they do try and go stop it, normally I would get some sort of email. I haven't had one of those in a long time. So I don't know if
Understood.
that's helpful.
Two, I got a call yesterday from a community leader that said she noticed that is a parked 7D police car on or near Rhode Island, and neighbors are just alarmed by it. I assured her that it's part of MPD's operations, but is there anything you can share about uh, empty police cars that may be parked along certain community routes?
Yeah, I don't know why a 7D officer would be parked there. The only thing I could say is at times we do have a take-home program. And our members live throughout the district, so you have to live within the city limits in order to get a take-home car. So we have 5D officers that live in other wards, other districts. So that's what it could be, if it's parked there. I mean, I could look into it if you find out the 7D number of the car. And every once in a while, though, when there's a significant event, like for instance, we had to officer the line of duty death. We had the funeral last week where we provided 5D provided the first district a few vehicles to assist so that the first district members could go to the funeral, and we handled calls for service. So I don't know if that's part of it. And I know the fourth district was down some vehicles due to the malfunction with the gasoline. I'm not sure if you heard that. Yeah, so I don't know.
I was not aware of that.
Yes, that happened I think at a couple different gas stations around, not just a district, a DC gas station, but actually I think it happened at a couple others like Costco. I think had something wrong. I think they fixed it pretty quickly at some of the other gasoline stations, but that put a couple of our cars down. So I know that we were sending the fourth district some vehicles, but I don't know if that's it. But feel free to write down, have the car number, and I'll research it for you.
And the last question that I do want to get to community questions is just, can you speak briefly to where we are with the force size? There's been a lot of discussion about attrition at MPD. The council has advanced efforts to try to grow the force, retain as many officers as possible. Can you just briefly speak about that? Because I think that is directly connected to the progress that we are wanting to make in the future.
Sure. Yeah, I mean, we're still short. We're really short. I think it's going to take a little while. We had a reduction. I don't want to say 1,000 officers or 1,500 officers, but if we're hiring, I think last year we hired 150 or 170 people, somewhere in there, and we're almost about break even with those numbers. So if that tells you anything, it's just still short. And I think this year is going to be a pretty busy year, especially, with some of the deployments that I've seen and in other cities around the United States. I believe that keep telling if you could keep pushing the hiring portion of things when you're out there. It's a great profession. So if I could tell you that we are in need, that's for sure, of more officers, at MPD. So I'm sorry that I wish I had better news, but if there's one problem that I could fix, that would be it. If I just had a magic wand, but we're still low on officers.
Oliver, I'm going to throw it to you to ask questions. But neighbors, you should also raise your hands if you have a question or drop it in the chat so that we can ask the commander.
You're on mute, Oliver.
Yeah, we don't have any questions that came from neighbors, so we'll wait for that if you guys have any. But since we do have DBH here, could you explain a little bit of the coordination between you and DBH in certain incidents where it may be a crime as well as mental health issues?
Sure. So with for instance, Starburst Plaza, maybe I'll start there. We do a lot of outreach, work with DBH, work with all our partners. We try and get out there, we try and change people's lives by continuously being in the community. I know at Starburst Plaza, and I've received a lot of flack for this with MPD, but we get out there, we're working with the homeless, working with people with, addiction issues. You can't police your way, or I'm sorry, you can't arrest your way out of an addiction issue. And in some of the neighborhoods that we've had, serious addiction problems, it is an essential thing that we continue to be in their ear when they're ready. And I think, you guys have been an instrumental part of this too, of being out there every time, especially at Starburst Plaza. We were doing weekly coordination with DBH, getting out there in the community, handing out Narcan, National Guard as well. National Guard will get out there and assist us as well, and give as much guidance as we possibly can to the community there. And when they're ready, they it really can do some help. So not just in that neighborhood, our community outreach team, they've been going to different neighborhoods into what I call our hotspot areas, not just with violence, but with addiction-ridden areas where we continue to either hand out flyers or we do our pop-ups. Starburst Plaza is the biggest one. I know we do other ones at different areas, but it's the one that includes DBH, DC Fire, National Guard, MPD, it's the Department of Health, and other agencies, church and religious organizations that also, go and frequent the area with us, and the walks as well. So, and I think our relationship, speaks volumes throughout the country. When I go to different agencies or different cities, they don't have the same relationship. They don't have these type of safety coordination meetings like we do, where, Oliver, I know both you and the council member, I've talked to you guys in the middle of the night sometimes about, scenes and crazy stuff that happens. Some of these other cities, they don't have the same coordination efforts that we do. So I think that speaks a lot to, these type of safety calls, make town halls and things like that. So, I think the more that we can get out there in the community, the better that we can, keep them from, committing crimes and, keeping their ear to do the right thing, change.
So thank you for that. Could you also explain a little bit about the operations for the core team? I know that has more of a mental health aspect to it as well.
Yeah, I'm not as familiar, and I know I'll let DBH talk with it, but I know that it's hits the most vulnerable communities, and I don't know if is there anybody from DBH want to like kind of elaborate on core?
Sure.
We have them coming up. If we could just hold off
Yeah,
for
we'll
one
get them.
second.
Yeah.
And if we don't have questions, we can go to the next person. I did see a question in the Q&A, Oliver, and I'll ask another why Oliver cues that up. We know that there is now a new police chief commander, acting Chief Carroll. Are there any new initiatives or strategies that acting Chief Carroll is employing that neighbors should be aware of? Or is it essentially maintaining the operations and strategies that were already in place?
Yeah, as of right now, there's no new initiatives right now. However, I want to say Chief Carroll's been around. I think he's the longest tenured assistant chief. He definitely knows what he's doing. He's out there. I mean, he's been in our Special Operations Division, Homeland Security Bureau, where he's run large. He was the one that actually went into the Capitol, into their command center, and actually ran everything from their command center to bring the Capitol back under control. So the guy's got an unbelievable. He's very, very, very smart. I think he's good for the city. I'm a huge Pam Smith fan. She promoted me. She was really good to us. But right now, there's no new initiatives that he's put together. I have a one-on-one with him actually on Friday. So I'm curious to see where his vision is. And I'm looking forward to some new ideas and fresh things that he will come up with, but nothing new right now.
Understood. And I think it's worth noting on the political side of things, it's my understanding that the executive doesn't plan to send down a formal nomination, just given that the executive's tenure is going to be ending in January of next year. Whereas the chairman of the council is requesting that a formal nomination be put forth. So I'm sharing that just for the good of the public, that if you hear that disagreement, that is what that's about. It is also worth noting that we've had acting chairs, acting directors for extended periods of time before. So I don't think, in all fairness, this is anything new. So there is one last question from a neighbor, and Commander, I feel like I know what the answer is going to be here, but I'll throw it out there. What is MPD's position on the recent SCOTUS ruling on probable cause?
On probable cause? I'm sorry, I'm looking for the questionnaire. SCOTUS? Where's that at?
That's a question from our neighbors. And if you want to take some more time to get a formal response from the chain of command, we can follow up with that. I figured you were gonna say you weren't gonna speak on a political question like that, but
Yep, no.
give it a shot.
no,
Give it a shot.
let me back up, and can I run away from here? I'm just kidding. No, I can come up with a formal response, and some of those things that are very politically driven, we're supposed to push it off to the PIO, make sure everything's kosher and things like that, and I'd be happy to
If
come
you
up with a response for you.
if you could get us a response, we would love to update neighbors in our newsletter, and
Sure,
we can make sure we get that to you. But Commander,
absolutely.
I want to say thank you. I want to say thank you for being here, for your leadership, for your coordination. I can attest to those late night calls where you are going out of your way to make sure the dots are being connected throughout government. Oh, I'm being told there is another question. I believe Commissioner Amin has a question before we let you go, Commander.
Okay, no problem.
Yeah, thank you. My actually my hand raise was not working. Can you hear me all right?
Yes, we
Member
can hear you.
Commander and director over there. Yeah, I just wanted to use this opportunity just to say that the 5D Community Advisory Committee will also meet this week, and so what we try to do at that meeting is to offer you a dialogue with the commander, the captain, the lieutenant, Oliver, whoever else is there. So not everyone likes, the virtual or putting forming their question into the chat. So we try to structure this slightly different, same format, but that commander will talk to you and till we tell them that we need to move on. So if you'd like to have more of a dialogue, whether it be with the commander or anybody else from the staff or people from council member office, please consider joining and attending the 5th District Community Advisory Committee. We meet in person and virtually alternating throughout the year.
And where can people find more? Well, actually, if you could just use the chat, or Oliver can drop information where people can learn more information about the CAC if they're interested. That would be
Great.
great.
Kelly Sislo and I will be generating the link this evening. We're going to meet virtually. So you can reach out to me personally for this evening. And then we're going to try to be a little bit more structured this year where we get that to your office in time, council members, so you can include it into your newsletter each
Understood.
month.
Thank you. Thank you,
Okay.
Commissioner.
Okay. Thank you.
And again, thank you, Commander, for your leadership. We are gonna keep it moving for the second time. But feel free to stick around, or not. And if you need to jump, we totally understand.
All right.
Next,
Thank
we're
you so
gonna
much for having me. Thank you.
absolutely, absolutely. And I would just say again, for the record, we've been pretty lucky in 5D with our commanders, and so thanks for holding the bar high. Next, we have our friends at DC Fire and EMS. Alexis Squire serves as the chief of staff to Chief Connolly and for the agency. And we are glad to have her here to lead us through this presentation. One thing I would just say of note, there have been pretty notable fire emergencies in and around Ward 5 in these cold months. And our hope is that through this presentation, we can take some or have some takeaways around preventative steps that we can have neighbors take, but also so you can be aware of all of the work that Fire and EMS is doing to keep residents safe. So with that, Ms. Squire, I'm going to turn it over to you.
Thank you so much, Council Member. I want to first start by saying thank you for this invitation. We are looking forward to our continued involvement and partnership and contributions to this call monthly. It's so exciting to hear and learn and be with our Ward 5 community members. As you mentioned, on behalf of Chief Donnelly, who is actually now right in our emergency operating center, making sure that we're all able to get back to some sort of normal after this storm. I want to say welcome. I'm joined and I'm pleased to be joined by several colleagues that you will hear from. And I think since this is our inaugural participation in this call, we're going to take and the opportunity to kind of share a little bit more about our operations and some of the things that we have, whether it be education and outreach, some of our data and some of our initiatives that we know are directly impacting your lives within Ward 5. And so I am really privileged to have this opportunity. And if you have questions, please feel free to put them in the chat. Our hope is that you will be more informed and that you will know a little bit more about what we do. So we'll go to the next slide. So as Councilmember Parker mentioned, we are in the middle of getting kind of recovery, if you will, from a recent snowstorm. But as he also mentioned, during the winter months, this is a really important time for us, great opportunities for us to work with our council members, with our neighbors, with our ANCs, and with you as neighbors around safety. And so I will turn it over at this moment to our Assistant Fire Marshal, Chief Tony White, to share a little bit more about safety messaging, things that we can share with neighbors around how to be safe and warm during this holiday, this season, I'm sorry.
Good afternoon, everyone. Hope everyone is doing well. Just like Ms. Squire said, we really appreciate you guys inviting us to hang out with you guys and pass on a little more information from the fire department, what we think about, how we operate, how we can help you guys, and how you guys can help us during this winter season. So just to jump right into it, the very first thing that I always think about are like your home monitoring devices, like your carbon monoxide alarms and your fire alarms. We just want to make sure that everything is up to date. We want to make sure that everyone has one of these things. I think later on in the slide, you will have an area where we have QR codes that allow you to do a home safety survey, which focuses 100% on fire safety. Also, we have a QR code that allows you to make an appointment to request a smoke alarm or carbon monoxide alarm. You fill out your information there, we'll come right out and have those things installed. Number two, there's a system called Smart DC. Smart 911. Smart 911 allows you to register anyone that may be under your care, that may have mobility problems. If they can't get out of the house, what it does is it allows us to know when a call comes out, we're informed that there's someone on the third floor who can't walk or something to that effect. And it allows us to gear our services towards those individuals during an emergency. Number three, cleaning your walkway around your homes, specifically in snow. The walkways are full of snow and ice. If you get out and clear the walkway in front of your house, and also if there are any fire hydrants around your house, clear those areas too, just to give us an opportunity to connect to the fire hydrant and also our members to be able to walk up to your house to help out during an emergency. Cleaning fireplaces, maintaining your fireplaces is extremely important. I know a lot of us don't think about it until it gets cold outside. And when it's cold during the winter months is when we button up our houses really, really tight. We close all the windows and make sure there's no drafts coming under the door. But it doesn't allow our homes to breathe well, right? So if you have gas-powered heating equipment like furnaces or water heaters, or if your stove is gas-powered, we do run a risk of carbon monoxide poisoning. That would be a reason that you have up-to-date carbon monoxide alarms and things like that. And lastly, space heaters. Even today, right, we still have fires due to space heaters or heating mechanisms, right? So when it comes to those things, we ask that around a heater, you have 3 feet of space clearance, nothing within 3 feet of them. We ask that they be plugged directly into a power source, not a power strip. And if you could check the back of your heaters or your warmers, just to make sure that they are tested by a reputable company like UL, right? If you have a UL in a circle, that's a trusted testing company. And if it has that, it's more safe than that, right? So those are a couple of things that I can think about right off when it comes to fire safety. Anything that I missed, you think, Alexis, or?
No, I think those are great. If you have questions, specific questions as it relates to your places of worship, your homes, or any other entity that you frequent, please let us know in the chat and we'll be happy to connect with you. Our hope is that you will allow us to be partners with you and as we navigate these winter months. And really, my goal is throughout this presentation that you'll learn opportunities where we are already in neighborhoods and that you all can join us or help us to amplify our messaging. So we can go on to the next slide. I think it's really important. I'm so great to see Commander Rooney and talk about and speak to some of the data that you all are experiencing in Ward 5. We too have data. One of the things that we think about often is our call volume, right? And so that is how many calls we are getting to a specific ward. If you look at this is over the fiscal year 25, you will see that there's a slight elevation in the calls that we've received from Ward 5. So we have our EMS calls, we have our fire calls. Interestingly enough, we are often just known as the fire department, but around 79 or 80% of our calls are EMS in nature. So that is something that we are constantly just, again, trying to get the community to understand the breadth and the capacity of our work. So you'll see there, you have your EMS calls, you have your fire calls, and then you have others. Other could be public safety, lift assist, someone is stuck in an elevator, or both fire and EMS, they often go into the other category. We see that increase, that 31,000 there. It's nothing alarming to us, but I will also say it speaks to the dynamic nature of the ward. We have colleges and universities. We have, a lot of green space. We have a lot of different dynamic of residences and businesses within the ward that make your ward, I would say, dynamic in nature in how we respond to calls. We can go to the next slide. These are our response times. So when we have the calls, we are also correlating with our response to those calls. We see here in Ward 5, this 0.07, which is aligned with our standards. Again, nothing substantial that speaks out to us internally around our response calls of Ward 5 versus other wards. But we are encouraging, these are things that we're as a leadership team often evaluating our staff around to make sure that when there is a call that we are responsive and timely in that response. We can go to the next slide. And then I'm going to turn it back over to Chief White. But before I do so, I would love for our viewers, our community members to be aware of is that we are going to always come. Whenever you call, our goal is always, our commitment rather, is to always come. But I do want to underscore that we are there before a fire or incident and after, right? And so as much as we are there for emergency response, we are equally as committed to prevention and to recovery. And so that is a lot of what our team that is here this afternoon is really in this prevention work, working within community to make sure that you are empowered with the resources and the skills to be able to support your community and being as safe as possible. All Hands on Prevention is one of those initiatives, and I'll turn it back over to Chief White to talk a little bit more about that. Uh-oh, you're on mute, Chief.
I'm sorry. So All Hands on Prevention is a monthly initiative that the fire department, Fire Prevention Division, SID, and some other groups come together on. And what we do is we go out into the community and we provide information, right? We provide smoke alarms, installs, carbon monoxide, and other information that's important to the specific area that we are going out to. So in 2025, these numbers have been updated. When we go out, it's the third Thursday of every month. So we'll be out in your communities and we'll usually, Alexis will usually allow the council members to know and your ANC to know when we're in your community. In 2025, the total residents visited were 2,583, and the total smoke alarms that were installed were 45. So I know a lot of times you guys or people look at the fire department as, hey, they're just on the fire trucks. just on the ambulances and they go to emergencies. But we're extremely heavy-handed in our community service, and how we focus in on the communities that we serve. So this is one of the initiatives that we put forth, just to make sure that that everyone in the city has an operating smoke alarm. If you're interested in a home, what's it called? I'm sorry, a fire safety home survey, right? We do those things also. So we're here, like Ms. Squire said, we're heavy in your community, and things that arise when it comes to the fire department. We don't miss a beat. So that's what All Hands on Prevention is, and I'm sure you guys will see us in your community this year, 2026.
If you would like to join us, the council member, your team, or other community members, for these walks, we're going door to door to seniors. We're talking with them. They were doing the home safety surveys in real time. If there is an install needed, we're installing in real time. If you would like to join us, please let us know, and we'll let you know the next time we'll be in the ward, and we would love for you to join us. It's a great opportunity for us to speak with one another, connect on priorities, and share more about what we're doing in the prevention space. We'll go to the next slide. Another contribution and offering that we have is our mobile integrated health, and it really dovetails really well into the public safety ecosystem. I know we had some questions around what is DBH doing, or how does MPD coordinate with DBH. We too are in this space. Our mobile integrated health team are paramedics. They are around prevention. They're creating patient-centered approaches to some of our most vulnerable patients. So this is some of that data. We're doing Narcan distributions. We are, finding alternative drug mitigation approaches with our residents. You'll see there Ward 5, helping folks to understand where stabilization centers are. And then we're also some of our high volume users that are having frequent lift assist. That is when someone might call 911 2 to 3 times a day. And we pride ourselves on, but these are people who have more chronic issues, complex, reoccurring issues. And so this team is dedicated to going to a little bit deeper and understanding their needs, integrating that health, and it's mobile, meaning we're meeting patients where they are. So we're familiar with Starburst Plaza. We're going there. We're helping with DBH and coordinating around some of these drug, prevention, education, and outreach. So that is something that we do there. One of our hallmark programs, if we go to the next slide, that we would love for our neighbors to know about is our home vaccination. We go back one more, thank you, to our home vaccination program. We do this in coordination with DC Health. If you have homebound, bedbound family members, neighbors that need vaccinations, we are more than committed to coming to their homes and giving them. This is a part of our MIH programming. We currently have COVID shots and flu, but as we have additional vaccines available from DC Health, we are going into homes and giving them to them. While we are there, we call this community risk reduction. We want to be as efficient as possible. We're also doing these home safety checks. If you need a fire, a smoke alarm, we're also doing the installs while we are there. So if you have folks that are interested or need this kind of service, their phone number is there, and we can also put it in the chat. But we would love for you all to contact us and let us know if you have residents that kind of fall into this category. Next slide. And so we also want to highlight, again, some of the education and outreach work that we're doing within your community. Whether it's our Fire Prevention Week, we typically partner with businesses and entities during this time. So we last went to Home Depot, we went to Lowe's, we're outside, we're making sure that our residents know about fire prevention, especially again with these colder months. We also have our Hands on Heart program, which is doing AED, Narcan, and Hands on Heart CPR training for any place of worship, nonprofit, small condos. And we actually in February will have an incentive program where your entity, whether it be a small condo, a nonprofit, a place of worship, can get a free AED. For the month of February, which is Heart Safe Month. We will give you the training that makes, that how your parishioners or your constituents know how to use it. But we know that in wards 4, 5, 7, and 8, there is a disproportionate rate of cardiac arrest and even greater gap within bystander training of how to be able to perform and to respond in times of these cardiac emergencies. So we want to close that gap, something that we're really committed to doing. Next slide. We also are proud to have opened and installed our first publicly accessible AED in your neighborhood at Turkey Thicket a few months ago with Director Freeman and the DPR family. This is, again, an initiative to make heart safe response as accessible as possible. So these AED boxes and devices are not only inside of a DPR entity, but they are outside. And we want our community to get as confident and comfortable as possible to be able to use them in times of emergency, especially in some of our sites where our seniors are often coming, our young people are often coming. We would love to be able to train you in how to do hands-only CPR and how to use an AED. That is not what we want to be the cause of not being able to respond to a neighbor or a family member in this type of crisis. We want you to feel as comfortable as possible. We are your partner to be able to get you there. We can go to the next slide. And then I'm going to pause here. I know that Chief Humphreys is also on. He is our battalion fire chief for the Ward 5, and I would just want to give him a moment before we get into this slide to share anything about any trends, any incidents, or updates that are really Ward 5 related.
Hey, good afternoon. I'm Battalion Chief Humphreys. My fire station is at 5th and Rhode Island, Engine Company 12. Lately in Ward 5, we had a couple major fires. Nothing of too much significance, no really harsh displacements. They all were pretty much house fires. We took care of them, and that's pretty much it. Ms. Squire already spoke on our response times and our responses in the city. So if you have any questions for me, I'm willing to answer them.
Awesome. I think you raise a good point, Chief Humphreys, that we're always tracking unfortunate deaths and injuries, but something that is another a point of accountability and reference for us is displacements. We know that when folks are having to leave their home, even for a week or, for months, that is a disruption, and it really has so many trickle-down implications. And so our goal is to really work with communities so that we don't have those displacements. When we do, we are often the first that we're coming back to those communities as well. And so as we talk about, and I'm referencing some of the pictures that you see here of what we're doing to make sure that we have a workforce that is reflective of our community, that is as diverse and dynamic as our community, but also what are we doing to kind of put our communities back together and respond. So I know that Captain Steele is on. If you could just share a little bit about our newest initiative, which is Return to Community, that would be great. And then I'll end here with these two flyers.
Yes, good afternoon. My name is Captain Steele, Captain of Strategy and Impact Division with DC Fire EMS. We have an initiative called Return to the Community, where we go to communities that after fires or tragic incidents or cardiac related incidents, where we kind of collaborate with other agencies and internal resources, such as like a Hands on Heart program, where we go and teach the community how to do hands on heart CPR. If it's a fire-related incident, we have our fire education team where we kind of go and teach them fire safety and stuff. We also bring fire inspectors where we kind of do like home checks and give them tips on, how to keep their home safe and everything. Also, if it's like a senior facility, we would kind of collaborate with like other agencies like DACL. If it was a death or something, we would work with the Went Center and for health and healing. Also the Mokers. So it's just like a community event. It's kind of like a well, small group of community just so we can make sure they feel that we're there for them. So that's something that we do after each incident.
Thank you so much, Captain Steele. I think you spoke to that eloquently. We're trying to make sure, again, when the fire happens, that's one way that we are going to be on scene and making sure that we evacuate and extinguish the fires. But we also want to rebuild community. Community is at the center of everything that we do. And then last but not least, if we could go back to the slide as we talk about how do we create this pipeline as a workforce development tool within the fire and EMS. We are in the business of creating new talent and new professionals, and we are really wanting to make sure that there is an opportunity for our DC grown young people to be a part of our DC Fire and EMS and beyond community. So we are currently have our cadet program that is open. We are going to have an info session. I will share with Oliver and Councilmember Parker's team when we have that info session. But this is a great opportunity for all of our high school students who are looking for a promising way to give back to community, to be a part of the fire and EMS department. So that is currently open and on our website. Additionally, we are partnering and so proud to partner with UDC to have the first publicly accessible paramedic program in the District of Columbia. We're really excited. We have 14 current members of Fire and EMS that are part of that. But again, this is just for your neighbors, your grandchildren, your children that are interested in developing as an EMS professional. This is a pathway to be able to do so. We're also really excited to be strong partners with the ATC program out of OSSI, both Ward 5 and Ward 8. We're helping to make sure that they get real life experience through coming and doing ride-alongs and visits in our sites. Again, we're committed to making sure that these pathways happen. And then I will go to the last slide. And if you have any questions, I don't know, I haven't been looking at the chat, but if there are questions, we can take them now.
Thank
Oliver,
you.
do you want to help us to?
Yes, Oliver will
Okay.
lift questions. I just have one, but can I just say, I think you are a great cheerleader for our fire department and our friends at Fire and EMS. Thank you for bringing the energy, but also shedding light on how you work beyond just addressing fires. I think that is news to a lot of neighbors. One thing I know you all routinely do is address overdoses or when someone may be in an acute medical incident because of drugs and what have you. Can you just speak to what that protocol is for you all, and how neighbors can support? I'll just give a specific example of what we've heard, and I think I know the answer. But in our Trinidad community, where we are still working to fight addiction and overdose, there are routine calls, more routine calls for individuals who are overdosing. Fire and EMS comes out. And some neighbors have concern that, hey, they work on this individual and then they're kind of left there. What I know is that you all have to honor the will of that person. So if they're not willing to go into care or go with you or go to the hospital, you all can't force them. But can you just speak to that side of your work, which might fall
Yeah.
under the other category?
Yeah, absolutely. I'm excited. We have Captain Smith here who leads our mobile integrated health, and she can speak directly to that question. Captain Smith?
Yes, good afternoon. So our mobile integrated health, we have paramedics and EMTs that come out from 10 o'clock in the morning to 8 o'clock in the afternoon. And anytime we get an overdose crisis, I have two teams that come out. One team is with the paramedic and the EMT. They go out, they assess the patient, and we have medicine that called buprenorphine. And we still have this patient on the scene at real time. We give this medicine to that patient. We always ask if they want it. If they do want a medicine, we give it. If they don't, we still have a COS, as a community outreach specialist, that actually get their information, and we keep updates and follow-ups with that particular person. We also have another. Sometimes after they hear the lights and sirens from the fire department, a lot of people, they tend to wander off. But I have another unit that also comes right behind after the fire department leaves. And we have two COSs there as a community outreach specialist along with EMT. So we come out and we pass out the civilian Narcan. This Narcan is totally different from what the firefighters have. Okay. And we also pass it out to the community. So we also give them information, and also we give them advice. And sometimes we take them to the stabilization center. A lot of times when the fire department tends to leave, when the community can see their own people, we can actually reach them better. So we talk and we educate them. We teach them how to use Narcan. And we still again ask them if they still need any type of resources, especially going to a stabilization center. And if they say yes, we definitely help them.
I really appreciate it. And why does this matter? Is because overdoses are still a factor in the district. And in fact, they are more prominent in wards 5, 7, and 8 and impact Black men the most. It is something that the Committee on the Health and on the council has been working intentionally with DBH to target. But I think it's important to highlight the work that Fire and EMS is doing in that space as well. So with that,
Yeah.
Oliver, oh, go for it. Sorry.
And no, I was just going to add that we're currently committed to the opioid abatement task force. We lead on the community risk reduction around a lot of the work that Captain Smith just cited. But to your point, council member, we're acutely aware of where the data is around that, and we're curtailing and really trying to specialize our interventions to meet where these demographics need it the most.
Awesome.
Ms. Squire, can I add one thing before you
Sure.
go to questions? All right. Just to give you a little background about your the first battalion. You have 6 companies in the first battalion, and that's going to be six engine companies and 3 truck companies. You have medic units and ambulances. In that battalion, you have 2 paramedic engine companies. And what that means is they have paramedics assigned to the engine. And just to piggyback on what Ms. Squire was saying about we're adding paramedics into the programs with GW. Also, I looked at the response times. And just to give you a piggyback on it, our response times for EMS calls is 5 minutes and 55 seconds. And for fires, 5 minutes, 20 seconds, and for other calls, 7 minutes and 10 seconds. And just to give you a little history on why it is like that, I know when you have an emergency, it may seem 5 minutes may seem like forever, but I think that we get there pretty fast to take care of our neighbors. So just to give you a little update, and just to give you a little history on, what we do and why. You got to remember that that 5 minutes comes from the call being put in, us getting to the fire truck, us driving safely there, and obeying the laws of the city and getting to your call. So
Yes.
just
And
give
we
you a
want you all to obey the laws of the city. Thank you.
yes. So,
I'm going to take another point of personal privilege. We do need to get to our friends at DBH. Oliver's going to ask one question. We weren't tagged in a note today, and I'm just curious how you all deal with this of fire and EMS crews, but also emergency crews that weren't able to get to the scene of an emergency because of the snow and the ice. And the message alerted that EMTs were going to be fashioning a sled with their equipment trying to get to the house. I'm assuming the fire truck couldn't get past the ice. In those instances, I'm assuming this is a one-off example, but not to put you on the spot, but how does the fire and EMS team deal with inclement weather if a truck is prohibited from getting to the scene of an emergency?
So I would just, before any of the chiefs respond, I would love to get more information about exactly where that is so I can look
Yep.
into the actual
It's 13th
incident.
place, 13th place in South Dakota Northeast. We were tagged in this a little over 3 hours ago, so it may not be an issue now, but neighbors were alarmed that the fire and EMS and other emergency crews couldn't get to the house because of ice conditions.
Okay, yeah, I would love to be able to look into that. Chief Humphreys, I don't know if you're familiar with that. It is very, I would say, an anomaly for us to not get to. And so I think what Captain Smith also, sometimes we may even have to take a unconventional route, but we're going to get to you, right? And so I have
I
100%
imagine
confidence.
is the sledding, which to me
I don't
said,
know. I don't want to speak to on the record what happened without looking into it and getting a little bit more
understood.
information. But we do work with our agency partners. So, I think you'll see messaging with DGS, with DDOT. It is really important, especially with inclement weather, that our apparatus are able to assist and support our neighbors. And so that's something that we're always committed to. We're overstaffing in these moments. We've had these, making sure that we have the personnel and we have the apparatus to do so. So I would give me the opportunity to look into that.
Yep.
That's something that we will get back in touch with you and Oliver around that specific incident and what happened there and how it was resolved.
Awesome. And for the sake of time, I'm gonna invite you all to answer one of these questions in the chat,
Sure.
if that's okay.
Yeah, that's fine.
And one question was, has Fire and EMS considered starting a program like MPD's Community Engagement Academy? I think you
We would
highlight,
love to.
yeah,
We would
but
love to
I think
give
you've
some
also,
investments. We would love to do a full scale community and engagement program like MPDs. I will say we do ride along so that community members and council members, we would love to have you for a ride along so you can get a firsthand look at some of the work that we do. But as we are evolving, this is one of my commitments to my bureau is as we're involved evolving our community engagement, we do want to get to this point of having an immersive experience. In the meantime, we have Camp Spark for your young girls. In the summer, they can come. It's a weekend, 2-day immersive experience where they get all of the women of fire and EMS. We do have a training academy. We are doing tours. Would love for our young people. We partner with Blue, with Eastern, and other high schools, Coolidge, around making sure that they have this pathway and this understanding and are able to touch and feel. So we're evolving it, but yes,
The
we are
action program as well.
and the action program. We partner with not DYRS, DOES, and that is our summer youth program. And we usually have 15 to 20 young people who then try and usually are successful to getting into our cadet program. So we
wow.
are certainly committed to that.
Awesome, awesome. We're gonna move on, but Oliver, can you take this next question and drop it in the chat? And
Yes.
if our friends at Fire and EMS can take a stab at it. But I want to say thank you for being here. Thank you for being a great partner. And everybody loves firefighters, and I think that's in part because when neighbors are in their bleakest moment, losing everything, you all are stepping up and putting your lives at risk to save the day. So thank you.
Thank you. It's an honor to work with these heroes. Okay. Thank you, council member.
Awesome. Last but certainly not least, we have our friends at Department of Behavioral Health. I am thrilled to turn it over to Anthony Hall to talk through some of the operational services at the agency, and then we will conclude with questions. So, Anthony, I'm going to turn it over to you.
Thank you so much for your time, and thank you everyone for having us. Excuse me, I'm sorry about that. So what I'll do in the interest of time is kind of do an overview of the department, and then we'll get into the meat of it. So the DBH in and of itself is the lead agency for developing, managing, and overseeing the comprehensive behavioral health system. And that's for adults, children, youth, families. It's all of the above. And it's really approaching things from a total person wellness perspective. So we're looking at the entire continuum of mental health and wellness, of behavioral health. As you've heard, DBH is partnered with essentially every um, agency across the district. And that's just because there is kind of that broader foundation of public health, public safety, homeless services, and community wellness strategies. So DBH in and of itself is broken down into a number of divisions, and that's usually helpful for communities to understand because it speaks to why all these partnerships exist, as well as some of the other arms of the department. So, if you think about clinical services, that is the part of DBH that oversees mental health and substance use disorder treatment for individuals across the spectrum, and that is both our our community providers. You may have heard the term CSA before. Those are the core service agencies. Those are the entities that we contract with who are providing that direct care to an individual who is receiving psychiatric treatment, who is receiving medications, who is receiving counseling services, who is receiving community-based interventions to help promote their living. Same holds true for our substance use disorder services. We are also the contract vendor for, or we're the administrators for the stabilization centers for our St. Elizabeth's, which is the state psychiatric hospital, but then also for our comprehensive psychiatric emergency program, which is the city's psychiatric emergency room. So all of these entities exist in kind of that clinical care space. With that, we have our crisis and stabilization services. So that is CPEP, where you might go for that level of care. That is our community response team. That is our access help. And I'll get into these more in detail. I'm just kind of running through them really quickly for your benefit. When we're looking at our youth and family services, that is our prevention programs, both looking at addressing needs of youth before perhaps they experience a substance use disorder, before they experience a psychiatric crisis, and helping just to understand and destigmatize what goes on with mental health and wellness. We are looking at that point, we're looking at children, youth, adolescents, and their families, and that is both our school-based and community-based programming. We also have youth-based crisis response through the CHAMPS program, which partners with CRT. We have our Consumer and Family Affairs division, and that is where you are looking at things like our peer training, where individuals with lived experience get certification to be able to go out and work with other individuals to help support them through their journey. One of the most amazing just an experience working with the peers and seeing how they truly connect with individuals and help support them through their own journey in the service system. And I know our Fire and EMS partners have peers that are there and supportive. Our MPD partners have worked closely with our peers, and it's really amazing. We have advocacy and education programs that happen through there, helping individuals learn to support a loved one who may be experiencing a behavioral health condition, or for those who feel that somebody may be being taken advantage of or is not getting the benefit of all their services. That is where that support comes from. Of course, we have our provider network management. These are the individuals who license and monitor our programs. So when community members are suggesting that perhaps somebody's not getting the services they deserve, you're really concerned about it. Those things get flagged, and we take a look and see, is this person getting the support services they need? How are we going about that? So that's kind of the big umbrella of the department, through things like our grants programs. You heard opioid abatement mentioned, SOAR, which is state opioid response. All these are how we bring online a lot of additional services to the district. So that's where we get our harm reduction teams. That's where we get our targeted outreach programs, which I'll speak about a little bit more in detail. It also allows us to do a lot of community education. So things like mental health first aid training for communities, going out and actually doing naloxone trainings in the field and for whoever requests them. All of that is what the department is. That's kind of the framing of the department in and of itself. And so now we can dive in. And I'm sorry if I'm rushing a little bit. I'm trying to be respectful of time. But if there are questions, I'm happy to answer anything. So in talking about, these will be kind of the direct response pieces of the department, which I think most of you have either interacted with, heard about, or these might be the areas where there will be definite touch points. So first up being our PATH team. So our PATH team is a street-based outreach group who specialize in working with unhoused individuals who who are experiencing some level of behavioral health crisis, often having severe uh, mental illness and are not strongly connected to the system. As we know, there can be a lot of things that result in somebody not being well connected with services. And so one of the hallmarks of PATH is to continue to be that familiar face, to continue to shepherd an individual through care. And if it doesn't work the first time, to really be there to help support them with that navigation. That requires also a lot of partnership with DHS, that requires working with our housing partners, requires working with some of the other street-based outreach programs just to help keep an individual connected with services. And if it doesn't work out, perhaps escalate their care to a different level. And we can go to the next slide, please. In that same space, we have the Access Helpline, and some people have heard of 988. It's branded as, it was originally branded as the Suicide and Crisis Lifeline, but the way to really think about it is when you need someone to call, when you need someone to speak with, this is an opportunity for anyone to be able to reach out and talk to a clinician and process what's going on. It's one of DBH has had an access helpline. The city has had an access helpline for a number of years, bringing the partnership with 988. That's when nationally we made the push. This is 24/7, accessible to everyone. You do not have to share any information if you don't want to. So we encourage individuals to utilize this because you get up to 3 free sessions with a licensed clinician. So there is no charge, nothing like that as associated with it. This could also result in a referral to care should someone be interested in linkage, or it could result in a referral to a face-to-face contact with one of our crisis response teams. So this can really be the front door for individuals. And so we really do encourage call, text. This is an open resource for everyone. So the Integrated Community Coordination Program. So this is a high intensity support program for those individuals who may have been connected, may have fallen out of care, but really we have seen that just asking them to follow up doesn't get the job done. So these are the individuals who are scheduling, who are shepherding folks through the process, who are talking to the provider to find out maybe what is the barrier to ongoing service, or working to assist them with continuing to be connected with service. So the ICC team really does a lot of that coordinated follow along until you get into that bigger system that I was talking about a little bit earlier. Okay. And just the community response team, that's our 24/7 direct care arm. This is anybody can call and request a face-to-face intervention. If there's an individual who you are concerned about, a neighbor can also call. For everyone, we will be respectful of privacy. That also means that for the individual you're calling about, we're going to do our due diligence and then engage them. You might not find out what happened because we have to be respectful of their rights as individuals, but this is a resource that we actively encourage you all to utilize. As you see, we coordinate with all of our citywide partners, so it's not just a one-off whenever you contact CRT. I know that we are strapped for time, so I'll end here, but definitely will drop my contact information in the chat and anyone can follow up with me.
Awesome. Thank you. And my apologies, Anthony, about the time. We're going to invite you back and we'll have you go first to just make up. But I want to thank you and all of our friends at DBH as well as Fire and EMS and our partners at MPD for joining us for this month's call. A recording of this call will be included in our weekly newsletter. If there are questions that you have that we weren't able to get to, please share them with us and we will seek to get answers. But the headline is that we're moving in the right direction in terms of public safety, and it's going to continue to take all of us to continue driving in that direction. So with that, stay safe and warm, and we will talk to you again soon.